Dr. Knuff. I work here at the Altoona Lung Specialist. I've been here 11 years now, and I've seen a lot of patients in the community and lots of experience here. I wanted to talk to you guys today about coronavirus and the risk of respiratory disease with that. Next slide. So when we talk about risk factors and we're talking about diseases, there's two types of risks. There's risk factors of getting a disease, and there's also the risk factors of what happens when you get the disease. So the risk factors for getting coronavirus, and I think most of us know this by now, it's been hammered pretty well, but age, race, gender, poverty, and blood type. So these things have been shown so far in the studies that we have. Obviously some of this is still brand new, some of this may change, but this is what we have right now. Age has been the biggest problem. As you can see on the graph here, this is on the left side is the whole United States, the right side is what we saw in New York City. New York City still had the most deaths that we've seen so far in the United States. So what I really wanted to point out with this lecture today was that this isn't a death sentence. I have so many patients that come in and say, Doc, I know if I get this, I'm going to die from it. I also don't want to give this lecture and saying, hey, go out and don't wear a mask and have fun. But I think patients need to be aware that, I don't want people freaking out if they do get this, that, their life is over. Even in the highest risk group, the 85 plus in the United States, we still only 10% died, which means that 90% lived. I have patients that come in and say, Doc, I know if I get this, I'm going to die. That's not necessarily true. Chances are most likely you're going to be fine. You may have some injury from it, you may have some insult from it, and that's why we say, there is a risk. You got to wear a mask. You got to do, what you're told here. But we also don't want everybody freaking out that they shouldn't leave their house. They shouldn't be trying to get some exercise. They shouldn't be trying to be active. I've seen more problems with patients not being active and being themselves than I've seen with the COVID so far, at least here in Blair County. So medical conditions that cause more severe disease. So there's conditions that cause an increased risk. Just like I said, when we talk about acquiring disease or not. So there's some things that make you more prone. There's some things that cause a more increased risk, and these are all similar between the websites that I've looked at: CDC, WebMD, and Mayo Clinic. So I think we're all pretty much set on those things. So increased risk, COPD is at the top here, mainly because we're talking about, that's what I want to talk to you guys about. But it's not the top when we're talking about conditions that cause an increased risk. Smoking does cause an increased risk, so we do know that. There are studies that show that people that smoke are more likely to get coronavirus. There's no pulmonary disease that has been shown that you're more likely to get coronavirus, but smoking has. And smoking is not necessarily a pulmonary disease, but it is obviously a behavior. So the diseases that do cause an increased risk of getting coronavirus: type 2 diabetes, obesity, heart disease, chronic kidney disease, cancer, sickle cell disease, and immunocompromised state. COPD, the question still remains, and we'll talk about that next here. So based on case reports and a weak meta-analysis on the CDC website, you can actually look this up, cdc.org. You can go to the coronavirus, you can look up these websites, or this website, and look up these facts. So there is a meta-analysis that showed that when they pulled a few studies together, that there may be a slight increased risk in patients that have COPD and getting coronavirus. But like I said, it's weak data. It's not the best data, unfortunately. Hopefully as time goes on, we'll collect more of that. There's been other reports that have come out and showed that there is no increased risk of getting coronavirus if you have COPD. You are felt to be more likely to have severe disease. That's not been clearly shown in any of the studies. There are, actually, I shouldn't say, there are two studies that have shown some increase in having issues if you have COPD and you get coronavirus. But it's not been universally shown. So the other thing is, with most coronaviruses, so there's other coronaviruses that cause cough, and there are coronaviruses that cause colds and such like that go around, and they've been around for years. And some of those will increase your risk of an exacerbation. But the novel coronavirus, the COVID-19, the SARS and the MERS have not been shown to actually cause COPD exacerbations. So that's an exacerbation is a flare-up of COPD. But can it cause increased risk of having complications? Yes. So this is one study. This is the American Journal of Infection Control. This is looking at COVID-19, and I know you most of you guys probably aren't research people. You're not data people. This may seem a lot, but I just wanted to back up some of this information for you. So this was in July of 2020. Studies show that COPD is not a prevalent condition in COVID-19 cases compared to CVD and diabetes. Similarly, mortality with COPD and COVID-19 is also lower than other major comorbidities. No clear association was found between COVID-19 mortality risk and COPD, which is consistent with other studies that have been done. Although elevated mortality risk due to increased disease severity has been observed in some studies. So it's anything in medicine. Unfortunately, I have some studies that say yes, some studies that say no. This is one that I cherry picked. It's basically, you can find another one that says there is an increased risk, but this was pretty well done. And again, this isn't to say to COPD patients, hey, go out and don't wear a mask and do whatever you want. No, it's just I want you to know that your life isn't over. I want you to be active and out and exercising, and obviously taking your precautions as much as you can. But I don't want you sitting at home watching TV doing nothing but sitting there. So other things shown a possible increased risk, and asthma's on the top basically because we're going to be talking about it. Smoking, like I said, smoking has already been shown to do that. Cystic fibrosis and pulmonary fibrosis. So when we look at asthma itself, so we do know that based on studies, there's no increased risk of getting coronavirus if you have asthma. And if you go to the websites and such, they'll tell you that. There are still concerns if you have asthma that you may have more severe disease, but there isn't really any data linking a lot of that to that. If you specifically look for articles, most of the articles do not show any increased risk. Now again, does that mean my asthma patients should go out and have a good time and not wear a mask? No. They should still take their precautions. But the other reason for showing this is we have a lot of patients calling in and saying, hey, should I retire early? Should I not go back to work? Should I take an extended leave of absence? Just with having asthma, maybe you should consider not doing those things. Maybe you should. Studies have yet to really show that there is an increased risk. So you may want to put that into consideration before retiring early, before not going back to work. There were some reports that said maybe non-allergic asthma patients may be more likely to have issues with coronavirus than allergic asthma. That's still being explored. That was a very small study, but I did want to mention that. So does asthma affect morbidity or severity of COVID-19? This is another journal, Journal of Allergy and Clinical Immunology, June 2020 and also July 2020 is two separate things. There was a retrospective study done in Northwestern Medicine hospitals. There was 10 hospitals, 1,500 patients. There was no observable difference in mortality rates between patients with COVID-19 who had asthma and those who did not. Now, when we talk about mortality and morbidity are two different things. Mortality means that you died because of the disease. So they're saying if you have asthma, you're not any more likely to die from COVID-19 than somebody else who doesn't have asthma. But it does not show morbidity. Morbidity is having complications. Is it still possible that you could have complications from COVID-19 with asthma? Possible. Again, we're still kind of early in this yet. We're still collecting all that data. So July 2020, there was 8 studies, including more than 17,000 patients, multiple geographic regions, found that comorbidity rates of COVID-19 with asthma were significantly lower than the reported prevalence of asthma in those respective regions. So the people that were being admitted to the hospital with asthma were lower than what they had seen in the regular cohort patients. So again, they're feeling that this maybe asthma does not put you at increased risk of getting the coronavirus. So pulmonary fibrosis, I threw this in here. The big three diseases we see in the office here: asthma, COPD, pulmonary fibrosis. Those are the three big that affect the lung. So I wanted to throw this in here. There's really not much data, and I apologize to those patients who have pulmonary fibrosis. There's just not a lot. From what I'm reading, most experts are saying that they feel it may be similar to COPD. There's probably not an increased risk of getting coronavirus, but you probably will have an increased risk of having more complications. And obviously it depends on the severity of your disease as well. If you have very significant pulmonary fibrosis, obviously if you add on any virus, it's going to be an issue. So I'm sure with COVID-19 it's going to be more of an issue. But the studies are lacking. It's just too few patients. So the American Lung Association, this is on their website. While individuals with chronic lung disease are not at higher risk for contracting COVID-19, they are more susceptible to severe complications if they do contract COVID-19. So that's right on the website. Again, not increased risk of getting it, but maybe there's an increased risk if you do get it of having complications from it. So in conclusion, although people with respiratory disease are not necessarily at a higher risk of contracting COVID-19, they may be more likely to have a severe infection. Most patients will likely recover from COVID-19. Like I said, COVID is not a death sentence. So many patients come in and say, "Doc, I know if I get it, I'm going to die from it." It's less likely. Is it possible? Yeah, it's possible I get hit by a bus when I leave the house today. But the other big thing is with this COVID-19 being out, there's been concerns of people being on medications, being on some of their anti-inflammatory medications, some of their, and we have some of those patients with pulmonary fibrosis on those meds. There's been concern about being on steroids. There's been concern about being on inhaled corticosteroids with asthma and COPD. The best thing that we can tell you from a medical standpoint is stay on your medications. Those medications will help prevent you from getting sick. Will help prevent you from getting having your disease be inflamed and being more likely to have a complication from getting coronavirus. So the best thing that we can tell you is stay on your medication regimen. If there's questions, call. We're here. Like I said, the best way to prevent a worsened outcome, as you can see on the bottom line here, is to keep yourself as healthy as possible. That's taking your medications, that's staying active, that's exercising, and that's taking care of yourself. It's the best thing you can do right now. So obviously, we are here. If you guys have questions for us, we are more than happy to answer them. We can give you a call if we need to. Thank you for your time today.